Most people assume there's nothing you can do for the common cold except wait it out, but that's not entirely true. There's actually a few treatments that can shorten how long a cold lasts or that can reduce how miserable you feel. The surprising part is that some of the remedies people swear by actually don't work at all, while a few others actually have measurable benefits in clinical trials. And if you start the right intervention at the right time, you may be able to cut a cold short by a couple of days. And who wouldn't want that? So in this video, I'm going to walk you through what the research actually shows about most common cold treatments, which ones shorten the illness, which ones only help symptoms, which ones probably do nothing, and what the evidence really means for people like you. First of all, you have to remember the common cold is a viral respiratory infection. It's not actually a bacteria. Usually it's caused by something called a rhinovirus or other related viruses. Currently, unfortunately, there's no treatments that cure the cold itself. Your immune system usually just ultimately has to clear the infection. But some interventions can influence how long symptoms last or how severe they feel. And one of the most interesting examples involves zinc. Researchers have been studying zinc lozenges for decades. The idea that zinc, which is basically an element, may interfere with viral replication is a fascinating concept, and that normally happens in the upper respiratory tract, especially early in the infection. But here's where the story becomes really interesting. Multiple randomized clinical trials and systematic reviews have found that zinc lozenges, those things you can buy in CVS or a pharmacy, can reduce the duration of a cold if they're started very early. So a 2024 systematic review looked at a bunch of randomized trials, and they found that zinc reduced a cold by about 2.4 days on average. And when you're suffering, 2.4 days is not nothing. Another systematic review of randomized trials found a very similar estimate, about 2.25 days of less duration of having a cold. And those are days that you could be back to work or be back to doing whatever you like to do with your life. And when you look at the overall evidence, the reduction is about 1/3 of the typical days you would have a cold. So zinc could reduce your cold duration by about 1/3, which is really cool. So instead of 7 days, your zinc intervention could shorten that to around 4 or 5 days. But there is a catch. Timing is very, very important. Most of the benefit occurs when the zinc lozenges are started within the first 24 hours of your cold symptoms. You wait longer than that, the effect appears to diminish pretty fast. That's why some people swear zinc works and others say it does nothing. Probably because the people who swear that it works started it right away, and those who found no benefit started it too late. The thing to also remember is that most of these clinical trials used zinc lozenges in the form of zinc gluconate or zinc acetate. That's not the same thing as just taking a pill of zinc that you might find in the pharmacy. And also the oral disintegrating tablets of zinc in Zicam, for example, they probably dissolve too fast to mimic what we know from these research trials. So the zinc lozenges are really what you need. The other thing to consider is the dose. The typical doses in these trials have ranged quite a bit, but often are between 45 milligrams per day to over 200 milligrams per day, taken as lozenges throughout the day for several days. So basically, they would take them every 2 hours throughout the entire duration after they started having symptoms. But there's also another downside. Zinc lozenges frequently cause some unpleasant side effects, and that's compared to a placebo. And the risk of having side effects is about 34%. And these are things like bad taste, nausea, or gastrointestinal discomfort. And this is about 1 in 3 to 1 in 4 people. So about 30% of people, which, yeah, if you think about it, it's not such a bad trade-off for some people who prefer having the cold for a lower number of days. So while zinc may shorten your cold for some people, there are some people who find it too intolerable. They're going to stop it. And in plain English, what this means is that start the zinc early. It's not a magic cure, and it does cause some mild side effects. So zinc is going to affect the duration of the illness, but many patients are actually more concerned with the symptoms themselves. Even if you reduce the duration of illness, is there anything that you can do to actually make the cold less intense? So this is where combination cold medicines are going to come in. Many of the over-the-counter cold products combine an antihistamine like Benadryl, an analgesic like a pain reliever, and sometimes a decongestant. So most of your cold medicines like NyQuil and DayQuil, they're just going to combine a bunch of these things that are focused on symptom relief. Researchers have tested these combinations in randomized trials. One analysis found that antihistamines and decongestants combined had an effect. And in some trials, about 70% of people taking these combinations reported improvement compared to about 50% in the placebo group. So you're looking at about 20% benefit. It's not a miraculous change, but it's something. So these medicines are not going to cure the cold, but they can make your symptoms tolerable. But you need to watch out for that Tylenol because it can cause liver dysfunction if you take too much of it. And about 30% of people are going to have these side effects of those antihistamines and decongestants. For example, excessive drowsiness the next day, or dizziness and lightheadedness. So you got to be careful with those. Now, there's another category of treatment that's received increasing attention, which is nasal sprays. And a randomized trial published in The Lancet Respiratory Medicine looked at nasal spray interventions specifically for these types of colds, these respiratory infections. And the results are really interesting. So there's two types of nasal sprays you can consider. One is like a gel-based spray, and the other is a simple saline spray. Both of these reduce the number of illness days by about 19%. So that's not a dramatic change, but it's something. And in the study, patients using these sprays had an average illness duration of about 6.5 days, compared to, remember, the average of being about 8 or 9 days in the non-intervention group. That doesn't sound so dramatic, but it represents roughly 1 to 2 days of reduction in illness duration. And that's not as much as the zinc intervention, but you can always combine those together. You could have a powerful combo of zinc plus the nasal spray. And the typical dosing for nasal sprays are 2 sprays per nostril at the first sign of infection, up to 6 times per day. And you don't want all the side effects of antibiotics. If you're trying to think of which type of nasal spray to take, one thing to remember is that gel-based sprays increase headaches and sinus pain more than the saline-based sprays. So personally, I would use the saline spray. Another intervention many people ask me about is vitamin C. Vitamin C, you probably see in the airport, everywhere in the supermarket. Emergency, take this for your cold. It's been studied extensively in randomized trials for both prevention and the treatment of cold. And the results are going to surprise you because they're not something most people know. So vitamin C supplementation does not, did you hear that? Does not appear to reduce the risk of catching a cold in the general population. So for example, one large meta-analysis found that the risk ratio was basically indistinguishable from chance, but there is one exception. Among people who are exposed to extreme physical stress, so for example, if you're a marathon runner or you're a soldier in intense training, that is a case where vitamin C reduced cold risk by about 52%. So probably for 95% of people, vitamin C is not going to reduce your risk of getting a cold if you're in the general population, but there's these really high risk situations and populations where it could benefit. Where vitamin C does show some benefit is in reducing the duration when it's taken before the illness happens. Did you hear that? So it's before the illness happens. So if you take vitamin C after the illness has already started, it's not going to do much. So in adults, regular vitamin C supplementation can reduce your cold duration by about 8%. And in children, that's about 14%. And this is going to be about 1 or 2 grams of vitamin C per day. However, if you take the vitamin C after the cold has already started, after you already have symptoms, it does not consistently reduce the duration or severity in clinical trials. So all those people who are taking emergency and taking very high doses of vitamin C after they already have sneezing, coughing, it's doing nothing for you. So if you take vitamin C regularly before you have a cold, that can help you slightly, but it's unlikely to do much once the symptoms have already started. Next, let's talk about antibiotics. Antibiotics are sometimes prescribed for respiratory infections. For example, if you think you have a pneumonia, but they don't treat viral illnesses like the common cold. So you don't want to jump to antibiotics, and you don't want to ask your doctor to give you antibiotics if you have what seems like a viral illness. Almost all things that you think of as a cold in the wintertime are viral in nature. If there's one thing you take from this, do not use antibiotics for a virus like the common cold. They don't treat the cold because the common cold is not caused by a bacteria. And then if you do take antibiotics, you have the risk of side effects from antibiotics, like they mess up your gut microbiome. Similarly, many herbal remedies have not shown convincing evidence of benefit, even though many people take these things. So echinacea is something that has been widely marketed for cold treatment, but systematic reviews have found inconsistent or weak evidence. So no to echinacea. Garlic supplements, maybe grandma told you to have some garlic. Sorry, grandma, but there's no strong evidence for prevention or treatment of colds with garlic. And other herbal remedies like oil of oregano, eucalyptus preparations, these have also not demonstrated any real benefits in clinical trials. This is also true for homeopathic products. These things with those long names you can't really pronounce, which you've probably never heard of. They're giving you a tincture of that here and there. These don't have much evidence either. Maybe the most surprising one is vitamin D. Many people know that vitamin D is important for immune system function, but it doesn't really appear to reduce cold duration or severity when it's used in treatment. So that might be a surprising one for you. No vitamin D benefit. So let's step back and see what actually helps you in summary. Zinc lozenges, not tablets or not dissolving tablets in your mouth. Lozenges, because you want to expose your mucosal membranes for a long time to the zinc, appear to have the largest potential benefit on shortening cold duration. And they're going to reduce the illness by about 2 to 2.5 days when they're started early, only in the first 24 hours. Nasal sprays also shorten the illness by roughly 1 or 2 days. And if you combine these with some of the cold medications that I mentioned that can improve symptoms, like antihistamines, pain medicines, these can improve your experience, but they're not going to improve the duration of the cold. Vitamin C is going to only offer real benefit if taken regularly before the cold starts, and pretty much everything else doesn't do much. So avoid the antibiotics, avoid the herbal remedies, avoid the homeopathy stuff. And if you're watching this because you have a cold, know that hydration, sleep, boosting your immune system through those two things is really important. And you have to sometimes just wait it out 7 to 10 days. And of course, if things are getting worse, contact your own doctor. This is not personalized medical advice. If you like what you're hearing and you like the depth, if you like this kind of evidence-based approach, check out this other video or join my free newsletter. Thanks so much. Take care.